everyone, I am Dr. Abbas Ali, your Orthopedics faculty with Marrow. Welcome to the Orthopedics module, and it is my job to introduce you to this beautiful world of orthopedics. So I really hope that you watch this video and understand how to proceed learning orthopedics in Marrow. You see, in this Marrow edition 6, we have made quite a lot of changes. With Marrow 5, we had already made it a clinical core module. But in Marrow 6, what we have done is we have enhanced it to the next level by making it relevant for you. What I personally have done is I have incorporated a lot of stories from my clinical practice, from my day-to-day OPD practice, and from the stories of patients who tell me how the disease has affected them or how they have improved. Now, the point of telling you these stories is to tell you the reality of this situation and how valuable it is to remember things. Whenever you attach a story to a fact, it becomes very easy for you to understand what is the importance of it. And it also helps you remember for a long term. Whenever I talk about eponymous fracture or a named fracture, I will tell you why it got its name, and I'll take you to the history of why it got its name so that you can understand the resemblance of it. For example, if I say there is an aviator's fracture, I'll tell you that the aviator word means a pilot, and these pilots, whenever the plane would crash, would land with their parachute on their feet and had their talus fractured, and so that fracture of talus is known as aviator's fracture. Similarly, I talk about lover's fracture and jumper's fracture and runner's fracture and a nightstick fracture, which is a fracture seen in people who raise their arm in self-defense. So there is stories behind these fractures, and when you know these stories, it becomes easy for you to remember. Also, while discussing cases, I have talked about the stories of presentation. In fact, I'll tell you what is the story of this patient. I'll tell you how he presents to me. I'll tell you what were his principal complaints or chief complaints and how I started working up to differentiate it from other clinical conditions. Now, apart from that, what I have personally done is I have shown you the clinical examination techniques of particular tests that are frequently asked on not only your entrance exams like NEET and NEXT, but also relevant for your final MBBS professional exams. The nerve tests, the test for shoulders, the test for the hip examination, these kind of tests I have shown you because it will be very handy not only for your MCQ exams, because I have seen quite a few MCQ questions where the steps of the examination or the steps of tests have been asked, but also to help you answer your Viva questions. And lastly, the latest thing that I've added is I've taken you to operation theater, showing you the procedures that we are doing. I'm showing you how we are performing fasciotomies, how we are doing open reduction and close reduction maneuvers. I'm also showing you how we are putting in pin tractions and other relevant orthopedic procedures that makes things easy and relevant for you to understand and grasp. With all these things in place, I'm very happy to introduce you to Marrow 6. But let me tell you how to utilize the beautiful modules that are available on Marrow. So what are the modules at your disposal? You have the video modules, the question bank, and you have your relevant standard textbooks, and also at your disposal in your medical college, you have a beautiful thing called clinical postings. I'll tell you how to utilize each of them so that you can be a master in orthopedics in no time. Let's start with video modules. The video modules are the modules where I sit down and talk in front of you and you listen to me and write down notes. Now, the thing that I have changed in this edition of video modules is that I have prepared all the slides beforehand. Every year, students used to tell me, "Sir, आपकी handwriting थोड़ी सी अच्छी कर लो," or try to improve your handwriting just a little bit. Or sometimes the students would say, "Sir, I can hear what you say, but I cannot understand the last part of that sentence or that word because essentially I am a very polite person. I speak very softly, but to circumvent that problem, I have written down everything on the slides." Now, this is what you need to do. You need to listen to what I have to tell you because I will tell you the stories, I'll tell you the clinical scenarios, I'll tell you what happens and how. After I tell you all of that in a very explanatory and a story-like fashion, everything that I have said will be written on the slide. All you have to do is pause the video and write down in your notes. So the aim is to first listen, understand what I have said, and then pause the video and write down everything that is on the slide because everything that is coming out of my mouth will eventually be written on the slide for you to copy, totally circumventing the problem of me writing down and you listening while you write down. Also in the videos, I have sprinkled it with a lot of questions that are asked on your Viva exam, in your MCQ exam, so that you should be ready for the exams. Even when you're not paying attention, subconsciously the information should keep going in your head. While teaching the subject, I've also tried to integrate it with other parts or other subjects. For example, in osteoporosis, I've talked about the pharmacology and the drugs. For examples, in basics of bone, I've talked about hyperparathyroidism and the manifestations of hypocalcemia and renal failure. So these are the kind of integrations I have made to make your life a little easy when it comes to orthopedics and allied subjects. And in the video modules, what is very interesting is that I have tried to make it as interactive as possible. I try to talk to you. I want you to talk back to me. I'll ask you a question. At that very moment, you need to pause and try to think of the answer and then answer me as if I'm talking to you directly one-on-one. Please try to do that, because the whole point of making this videos interactive is to help you understand and to keep you engaged in learning this dry subject, which I've tried to make it more palatable for you. Now, the second aspect of the module is the notes that you prepare with your hand. I would prefer you do that, but if you purchase the ready-made notes also, that's not a problem. But the point I'm trying to make is, like I said, every slide is a written slide, so you can copy it easily without a lot of problem, without confusing the spellings or whatnot. But make sure you make it your own so that it becomes easy for your revisions. Now, occasionally, every now and then, I would come up with recall videos or update videos. Basically, recall videos are these videos where I answer the questions that are asked in the recent exam. There are new pattern and changes. And update videos will introduce you new things that are possibly going to be asked on your exam. These are both can be found on my personal YouTube channel, that is the Bone Teacher, or Marrow YouTube channel if available. So you can go and access that and learn from there as well. Now, after you've watched the videos and prepared your notes, I suggest going and doing the question bank. Please do not be hesitant or afraid of doing the question bank, because a lot of students think question bank is a testing tool. And I keep telling you, question bank is not a testing tool, it is a learning tool. It will help you fill up the gaps in information that you might have. You see, as a teacher, I will tell you that I cannot teach you everything. And as a teacher, nobody can teach you everything. But when you do the question bank, what will happen is you will start to fill in the plugs, fill in the spaces that are there in your understanding. The question bank takes questions and clinical scenarios and makes it relevant for you in terms of specific answers, in terms of differential diagnosis. So I urge you to do the question bank of the modules that you have watched and made notes of. And also, please try to understand that question banks not only serve as a learning tool, but they also serve as a revision tool, because you have just learned something in the videos and now you're solving the questions. It becomes a revision. Finally, once you're done with these things, you obviously have your standard textbooks. I suggest two standard textbooks right now. One of the two is fine. Apley's or Maheshwari is fine, at least till my original textbook comes out. But the point I'm trying to make is, do the textbooks at any cost. You might feel that it is redundant. You might feel that there is no point in doing the textbook because you've already learned in the videos and made your own notes and have solved the question bank. But you see, the point of doing the textbook is that you master, or you earn, or you learn the skill of sitting and reading, which is very, very helpful in your post-graduation later in life. And also, there'll be a lot of information there in the textbook that will help you make bulk on your answer sheets when you're writing your professional exams. It will give you an idea of how to make the diagrams, those flow charts. So I really urge you to do that. Don't skip out on reading a textbook. Finally, the last asset in your arsenal of tools is your wards, the clinical postings. You will learn a lot of things in your wards, your OPDs, your theaters, and your post-op. Please do not skip it. Please do not miss it. This is the information that you will not find anywhere, neither in your textbooks, neither in your MCQs. These are the things that you will probably find in the wards itself. And trust me, eyes will not see what the brain does not know, but I am preparing your brain to see in the wards. And once you see something, you will remember it for a very, very long time. So go to the wards, pay attention, and I'll tell you what to pay attention to. When you go to the wards, I want you to make sure that you look at the splints, the various splint, the Thomas splint, the Bowler and Brown splint. Look at various x-rays of fracture. Try to diagnose the fracture on the x-ray. Is it an intertrochanteric fracture? Is it a neck of femur fracture? Is it a supracondylar humerus fracture? Is it shaft of humerus fracture? Look at the procedures being done by your seniors. Are they aspirating a knee? Are they injecting a steroid in the acromial space? So ask questions properly. The only way to learn is by asking questions. You see, if you have the knowledge already with you, you will be ready to ask the proper questions. And trust me, seniors respond well if you ask the right questions. Now, also in the OPD, don't be this person just writing down diclofenac, sodium and paracetamol. Ask questions there. Look at how your seniors are performing tests. Look at how they are doing the anterior draw test, the Neers test, the Hawkins-Kennedy test, the test for the shoulder, the test for elbow, the test for knee. Ask questions if you have any doubts. Look at how the patients present to you with their classical clinical features. A patient will tell you he has pain over the lateral aspect of the elbow after riding a bike, classical of tennis elbow. The patient will come to you with a swelling around the elbow following a history of massage, classical presentation of myositis ossificans. These kind of things you will only pick up in your OPD. Also look at your professors and associate professors. What kind of investigations are they writing? Are they asking only for X-ray? Are they asking CT scan for the bone? Are they asking MRI for a soft tissue injury? Are they asking ultrasonography for a swelling? Pay attention why they are asking for it and ask them, why sir, why not X-ray this time? Then he might tell you that this is a lesion that we are suspecting in the bone. That's why we are getting a CT scan and not an MRI. When you go to the theater, don't be somebody who's just sitting outside and wasting time. Look at what is being done. Look at the preoperative X-ray. Look at the procedure that is being done. Look at how the fracture is being reduced, either if it is being reduced openly or if it is being reduced closely. You can look at the C-arm or the image intensifier and see how the fracture is being reduced. Every time a procedure is being performed, ask whether it's a closed reduction or an open reduction. Your seniors will be impressed. Whether it's an internal fixation, whether it's an external fixation, what kind of procedure, what kind of plate, what kind of screw, what kind of nail are they putting in the bone. When you're interested, you will learn so many things that you will be surprised you didn't pick up in your classes. Now, after the surgery, make sure that you follow up the patient and see how they are made to start walking, how they are made to start moving their limbs, the rehabilitation protocol, and follow them up when you're there in the postings for a month. Follow them up, see them if they come back after a week or 2 weeks or 3 weeks. Look at the X-ray and see if the callus formation has already started or not. This will give you the motivation to follow patients and probably pursue orthopedics also in the future. And once you have done all of these things, that is watching the videos, doing the question bank, reading the textbook, and paying attention in the clinical postings, when you start revisions, things become extremely easy because you have learnt it from so many different places. And trust me, the first revision will always be the hardest, will always be the longest. But as you keep on revising and you use the 1-2-1-2 principle, which I have talked about on my YouTube video, what will happen is your revisions will become more specific. The duration will be lesser and you will be focused on the areas which you are weak at. And by the time the exam comes, it will hardly take a few hours for you to completely revise orthopedics and you will be master at it. And you will be master at it not only for your exam but also for general life. You'll see a lot of patients. Suppose you do general medicine or pediatrics or ENT, you'll still be very knowledgeable when it comes to orthopedics, and that's a good thing to have. And finally, if you're ever in doubt in terms of academic concerns or non-academic concerns of your student life, feel free to get in touch with me. These are all the places where you can find me. I wish you all the best, and I would like to personally welcome you into this module of orthopedics. Stay with me, stick with me. I'll hold your hand and I'll guide you all the way to the end. Let's start.